a great question. So I'll try to summarize the question. So how does this food addiction model interplay with body acceptance, weight diversity? Do you tell patients to restrict your food or restrict calories? And how do you balance that with validation? This sort of dovetails with another question through the chat about, well, how do you treat it? Are there harm reduction sorts of models or balanced models?
Yeah, it's a great question. I'm very glad you asked it. So regarding the body acceptance piece, I think that I have so many, I could spend half an hour talking about it. So I have to come up with the words that I want to use that'll be brief. I think obviously we need to encourage everybody to accept the body and love the body that they're in. But I don't think we need to have health acceptance. So if someone's in a body that's beautiful, but maybe it's causing them health problems, we want to change their health. And as a result, their body may change as well. So I feel like the focus should always be on health, not on what you look like, but on your health and the risks that you might have for getting health-related complications based off of your BMI, blood pressure, and other measures that we have. Now, the second part of your question is, do we then tell people to restrict? I hate the word restrict. I want to erase it from the conversation because I feel like that's where we have a lot of problems, especially when I'm talking about our research to individuals in the food addiction community, because you guys hate the word restrict, and I get it, I hate it too. I think when we think about addiction, all we can do is think about restricting. Like if you're addicted to alcohol, you have to restrict your alcohol intake. You can't eat it, you have to abstain. We use those words, but I think that we need to keep in mind, like I said, food is not the same as drugs in the sense that we live in a very different society with food than we do with drugs and alcohol. And so my take on it is we want to tell our patients to make choices that are going to be healthier for them. So if you're going to choose to not eat sweets all the time, maybe you're going to eat them some of the time, but you're going to choose to not eat them all the time. That's a choice you're making. You're not restricting, you're making a choice. And so those are the types of terms I like to use, and I think when we use those small nuancical terms, it can actually make a big difference on how people approach this idea and how we fold the addiction model in. One last thing about the harm reduction piece, this kind of gets to something that Kim and I were talking about earlier. The traditional addiction model is an abstinence model where you cut it all out. That works for alcohol for some people, right? Because it's very easy to see where the alcohol is. Doesn't work for sugar or food because there's very many shades of gray when it comes to what foods we should or shouldn't avoid. Harm reduction often can work for alcohol too. People can go from being a quote unquote alcoholic, identify as an alcoholic, and being able to then maybe drink 1 or 2 glasses of wine a week. And they've been able to quote unquote reduce the harm. But what I think is a better way to talk about it, and Kim and I talked about this earlier, she actually used the word, so I'm going to steal them from her. It's not about reducing the harm, it's about living the life that you're choosing to live based off of these types of choices in your diet. And so if you're choosing to not eat foods that you know are going to harm you, like Pop-Tarts, which I don't think are foods, so you're choosing to eat a food that maybe isn't even a food, that's the discussion that I think would be good to have.
Yeah, and when I talk about recovery, whether I'm talking to somebody with bulimia, anorexia, that plus minus food addiction, substance use, depression, I talk about, recovery isn't about stopping things, it's about expanding your life and expanding your health and being restored to having the power of choice. And my choices might look different than your choices, right? Because we all have different preferences and values. One person might be totally fine having type 2, well-controlled type 2 diabetes using metformin or whatever, medication. Another person might say, I want to try to not have to take a medication for diabetes. So are there nutritional things I can do? So we talk to people about health. And not about if you're in recovery, we're going to be focusing on health, what it means for you. Your body might gain weight, your body might lose weight, that. Your body is built to take care of itself when we focus on the health.